The Northwest Health Department, meanwhile, has cautioned residents that it may not be able to admit people who have fallen ill due to COVID-19 related complications in private and public hospitals. Now, the provincial department, we're told, says that a number of infections during the third wave seems to be going up quicker than the first and second waves, and it blames this on the behavior of people who do not want to adhere to COVID-19 regulations. But unions like NEHAWU in the province are blaming the department for how it handles vaccinations in that province. Let's get the very latest. Bring in SABC News reporter Sentleeng Lehihi live for us in Mahikeng. Sentleeng, what more are we learning about the story?
Good morning to you, Blaine, and our viewers. Indeed, the rate of COVID-19 infections in the province has gone up quite alarmingly. We have seen the MEC of Health in the province, MEC Madoda Sambata, issue an alert on the department's social media platforms that the province now finds itself among the 3 provinces with the most or the highest rates of active cases in the country. First being Gauteng, followed by the Western Cape, and now the Northwest at over 21,000 active cases as at the 9th of July, Friday. We understand from the Department there of Health that this has created quite a concern for the province, seeing as how our bed facilities and availability for hospitalization will grow under increasing strain if these numbers continue to go up at this escalated rate. The MEC of Health has also sent, an alert that the growing numbers and deaths has also become quite alarming. The province, as at the 9th of July, had over 2,500 deaths due to COVID-19 complications. But to understand how the situation is looking on the ground, we're joined by NEHAWU Provincial Secretary Patrick Makafani. Mr. Makafani, pardon me. Thank you very much for your time. Can you just paint us a picture of the situation on the ground?
Thanks very much. Look, the situation is not so pleasing. You would recall that we are a very big province in terms of the numbers. We, as the health workers, are expected to cater for over 4 million people in the Northwest province. And it will therefore mean that the health care system in the province will be extremely under pressure. And that's the situation currently, that you would find the very same health care system struggling to cope with the pressure that is brought about by the third wave and so forth. So the situation, insofar as our workers and our members is concerned, is that which warrants a serious attention, and that there must be an amplification really of the process of vaccination, first to finish internally in the health system, so that the health care workers, all of them, can really be confirmed to be vaccinated, so that then we begin to address the very same challenge of the population of the Northwest province in an expeditious manner that will ensure that we really keep up with the momentum. And as matters stands currently, as we have correctly said, we are running far behind in catching up with the speed at which the pandemic is moving ahead of us. And that is a really serious concern for all of us in the province.
Of those health workers who still are left behind in the vaccination drive, are they optimistic and willing to participate in the vaccinations? Is it not a matter of them not being willing to vaccinate?
Look, it is a mixture of both. There are still those who are reluctant. I think that our people have been looking too much on the negative aspect of it. The side effect that comes with it, and not sure whether will one pull out, survive after the side effects and so forth. It's an ordinary fear of a human being. But we think that the greater number is that those who have really not been reached out in terms of the actual vaccination is concerned, and that on its own has got a direct impact at the speed at which the department must roll out the process of vaccination. And that is a real challenge that must be addressed. The department has got over 30,000 employees, which by a number, of course, 30,000 is not even a fraction of reaching out to the 4-point-something million people in the Northwest province. That should tell you that the health department will struggle to cope with the pressure. And so the speed at which we started at the beginning of it all was supposed to be that which shows that there's a serious commitment in prioritizing the healthcare workers, such that when we get to at least the second wave, you are done with the healthcare workers. But as matters stand, we are still not done, and the community will obviously panic that we have entered now the third wave, and the health workers who must really deliver has not yet been completed. And we have already moved to some sections of the society with that slow speed, which you are still trying to catch up. The reality of the matter is we think that we are very, very much far behind. By this time, we're supposed to have done a significant number of the population, at least in the Northwest Province. And this is a call for concern that this process must really be amplified.
Thank you very much, Mr. Makafane. Mr. Makafane, the Provincial Secretary of NEHAWU, they're painting quite a bleak picture of the situation on the ground facing health workers amidst this pandemic, explaining to us there that, there's still quite a number of health workers who are still to get their much-needed jabs, but it seems that, provincial authorities are actually rushing to, vaccinate other sectors of the population without, prioritizing, concluding these much-needed vaccinations of essential workers. But for now, here in Mahikeng, we're going to try get more context from the residents. Until then, back to you in studio.